As the COVID-19 pandemic swept across the globe, much was made about the origins of this new virus for humans. Many experts hypothesized that the natural reservoir for the virus was a mammal species like bats, from where the virus then spilled over into humans. What about transmission of the SARS-CoV-2 virus from humans back into animals, like wildlife? As the pandemic evolves, it may become necessary to think of it as a pandemic that's shared between humans and animals.
On November 2, 2021, the New York Times published an article, Widespread Coronavirus Infection Found in Iowa Deer, reporting on the worry among experts about a deep wild reservoir of coronavirus in deer. The level of COVID prevalence in deer may be new, but it is far from the first documented case of the virus in non-human mammals. SARS-CoV-2 has previously been found in cats, dogs, ferrets, mink, and several animal species in zoos and sanctuaries. Are we raising the alarm again unnecessarily for deer, or is there real potential for a new wild reservoir of COVID-19?
White-tailed deer range over the entire continental U.S. and are particularly adapted to peri-urban spaces, coming into frequent close contact with humans, unlike many other wildlife. The deer are particularly prevalent in the eastern United States near urban centers. That's us.
In August 2021, antibodies to SARS-CoV-2 were found in 40% of 385 wild white-tailed deer serum samples taken in Michigan, Pennsylvania, Illinois, and New York. Additionally, the same month the USDA announced the first confirmation of active SARS-CoV-2 infection in white-tailed deer in the state of Ohio. The transmission route to the deer remains unclear, but likely originated from human contact, potentially through hunting, feeding, or urban herd management. So far, the deer studied showed no symptoms or illness, but questions remain. How is the virus transmitted to deer? Will deer become a reservoir for COVID-19 in the US? And, most importantly, can the deer spread the virus back to humans?
Viruses and bacteria don't recognize the neat boundaries we humans draw around species. There's the potential that the coronavirus circulates indefinitely in hard-to-reach animal reservoirs like deer, stymieing efforts to eradicate the disease. More alarming is the possibility that, while circulating among deer, the virus may evolve or recombine, so as to evade the immune response when and if it spills back over into humans. We've already seen new variants emerge during the course of the pandemic. If deer become spillover hosts, more virulent strains could be reintroduced into human populations. But how well-founded are concerns that the wide circulation of SARS-CoV-2 in deer poses a risk to humans?
I still don't think the biology of the deer is going to lend itself to becoming a reservoir that's going to greatly be a risk to humans spilling back over. That's my personal take. And it's based primarily on what I understand about coronaviruses and also about deer biology.
That's Dr. Suzanne Kennedy Stoskov, Research Professor Emerita of Ecosystem Health and Wildlife Disease at North Carolina State University's College of Veterinary Medicine. She stresses a more nuanced evaluation of potential risk.
Is it going to be able to sustain continuous propagation? So we're always looking at the reproductive ability of any virus, and the three conditions is like, how long are you infectious? How many susceptible hosts do you come in contact with? And how many do you actually infect? And when you look at white-tailed deer, say, versus rodents or bats or people or birds, which make great reservoirs for a lot of viruses that go back and forth between species. Deer they don't congregate in large herds. They're not a herd animal. I mean, they'll be in small groups.
SARS-CoV-2 infection in white-tailed deer may or may not drive human infection. But the potential for recombinant and spillover events emerging from wildlife and human overlap in increasingly fragmented ecosystems makes integrated surveillance inspired by One Health paramount.
So kind of sit back and I go, I wonder what's going to happen next, and hope that we don't have recombinant events. It's going to change. It's going to mutate. It's our largest coronavirus. And so it can be sloppy in its replication. And so some of its mutations aren't to its advantage, and others are going to make it more advantageous to transmit and be able to spread more readily. It's the nature of what they do.
These risks are only amplified by ecological fragmentation caused by human activities.
There's been perturbations in nature. I mean, it's not like these viruses are new. It's not like, people have created them in a lab. They are out there in nature. But what we have done is destroyed barriers that have been, not barriers, but natural ecosystems that have isolated the true reservoirs from animals that can become susceptible.
Spillover and spillback events can only occur when animals and humans come into close proximity. The frequency of this contact is driven by a complex series of interactions, interplaying between human attitudes, human and animal behaviors, and shared environments, such as those seen in many urban and suburban settings in the United States.
And if you look at Illinois, the northern part, they're all in the northern part in Chicago. So those are peri-urban deer. And so you do have an abnormal congregation of deer that's created artificially.
As deer populations have increased, debates have risen over the animal's value.
But people have different viewpoints. I mean, if you're a hunter, you're looking at it for recreation and meat. But a lot of people like those front yard or backyard deer and they feed them, which is a terrible thing to do. And that would actually encourage the spread of, and may explain how coronavirus got into those deer, because of bringing deer into closer contact with people than they normally would.
Despite multiple attempts to interview local deer hunters, none agreed to speak with us on the record. After the identification of coronavirus in deer, several states are now advising hunters to take precautions when handling their game, such as wearing rubber gloves and masks when dressing and processing venison. Alternatively, deer could be vaccinated against SARS-CoV-2, an approach already taken for many animals in zoos, but capturing and vaccinating scores of wild animals is infeasible. Culling deer through capture and targeted killing would directly reduce viral risks for both deer and humans by reducing deer population density in peri-urban environments. But this option can face significant pushback.
But it's not popular. I mean, because again, people don't want to kill the deer. It almost defies logic because there's so much emotional investment in these animals, which from a population standpoint really isn't particularly healthy.
We still know little about the coronavirus disease pathology in deer, if it causes disease at all, and still less about viral mutations resulting from deer infections. We don't know the effect of deer population density on coronavirus epidemiology in wildlife, or the defined routes of transmission between deer and humans.
We do know that habitat fragmentation can prompt deer to migrate, though we don't yet know if this is at all responsible for the infections detected in the Midwestern states. Ultimately, reducing infection risk from wildlife will require navigating complex sources of interaction. A One Health approach, including experts from a variety of fields, can help identify solutions that protect human interests, the well-being of wildlife, and our shared environments.
So we do have a bias, getting back to speciesism, that yes, we're putting a lot more money into research for people than we are for animals.
Wildlife disease surveillance as front page news represents an important opportunity for One Health to move the conversation away from a human-centered bias into a viewpoint that considers both human and animal health.
We should, of course, monitor viral and other diseases in wildlife, especially those that we share an environmental niche with, like deer. One Health can help inform and prioritize these sorts of surveillance efforts, considering the environmental changes that contribute to human-animal interactions, as well as the social dynamics and social structures of wildlife that may pose an increased risk to humans and interspecies disease transmission, but only if we go looking for these dynamics.
And while it might be premature to raise alarm bells over the presence of COVID-19 in deer, one thing is certain. In order to move past this current pandemic, we need to start focusing on the health of species beyond just our own. It's time to realize we're all in this together. We've been wandering around here for hours. Ian, I told you to bring a map.
I thought Caroline had it.
Don't these rocks look familiar? Have we been here?
I don't.
What's that?